Hello, I'm Matt Galloway, and this is the Current Podcast. The weight loss medication Wegovy is now available in Canada. Wegovy is a brand name for the drug semaglutide. It is approved for chronic weight management to treat obesity. This drug is made by Novo Nordisk, which is the same company that created another popular weight loss drug, Ozempic. Wegovy does not come cheap, though. It costs about $400 a month indefinitely, and there is debate over whether that cost should be covered by pharmacare plans. Dr. Sanjeev Sokalingam is the Scientific Director for Obesity Canada. Dr. Sokalingam, good morning.
Good morning.
Tell me what the promise of this drug, Wegovy, is for somebody who is living with obesity.
Well, I think for people who are living with obesity to date, we haven't had many good treatment options. As per our Canadian guidelines, there's really three main treatments: psychological treatments, medications, and metabolic and bariatric surgery. And for the medication arm, we've been very limited. Now, with the advent of new research and trials, we have new agents such as Wegovy, for example, or semaglutide, and that has provided significant promise, both in terms of options, but also greater effects in terms of weight loss and improved health outcomes.
How does it compare to Ozempic? This is a drug that, as I mentioned, a lot of people have turned to, perhaps for, I don't know how you frame this, more cosmetic, if I can put it that way, weight loss concerns.
Yeah, I think it's important to be clear about this. We're talking about treatments for obesity being a chronic medical condition. This is not for cosmetic. And when we define obesity as a chronic medical condition, we're talking about when someone has excess adipose or fat tissue that impairs their health and functioning. And so I just want to differentiate that when we're talking about cosmetic versus a medical condition or a medical treatment.
We should also say that we have spoken with people who have taken Ozempic who say that it has improved their medical. It's not just for cosmetic purposes, but it has also improved the quality of life and how they feel in terms of a medical condition.
Right, 100%. And I think that's the important piece. And how it compares to Ozempic, well, Ozempic and Wegovy have the same underlying agent, semaglutide, which is the generic name for the medication, which is what we call a glucagon-like peptide 1 or GLP-1. Mm-hmm. We make this as part of incretins, which are a family of hormones in our body that are released in response to when we eat and help us store glucose. And we have GLP-1s in our body. We produce it, but we may not have enough of it. And in fact, people who are living with obesity have less GLP-1. And so semaglutide is a GLP-1, and it provides that opportunity for patients to have enough of it for both blood glucose regulation, which is where Ozempic came into play, but also more importantly, to have impacts both not just on our pancreas and our gut, but also on our brain, which impacts obesity care and obesity management. And so that's the difference. Wegovy is a higher dose of Ozempic. It's at 2.4 milligrams. That is the dose that was tested in clinical trials.
The drug agency in this country has recommended that provinces and territories do not cover the cost of Wegovy because the health benefits beyond weight loss, according to Canada's drug agency, are not clear. Do you believe that this drug should be covered?
I believe this drug should be covered for a variety of reasons. I'll tell you why. I think we know that 1 in 4 Canadians are living with obesity right now. And I think myself, as part of Obesity Canada and as a clinician and researcher in this area, would also agree that we need to also invest in prevention of obesity as well. But we have many people living with obesity in Canada. We need treatments available. We've recognized for over a decade obesity is a chronic medical condition. And we, as a result of that, if you have a treatment that works, and let's talk about what you just mentioned in terms of the request for greater information on health benefits, it works not just for weight loss. As I mentioned, obesity is about the impacts on health. And we know from additional research, which was requested, that patients with pre-existing cardiovascular disease who are overweight and obese, who are treated with semaglutide at this dose, that is the dose for Wegovy, had an increased reduction in cardiovascular events and causes. And so we know that this is going beyond weight loss. This is really about protecting one's cardiovascular health as well and some of the complications. So if I were to say to you that we had a cancer medication that seemed to work better than other agents, had better health benefits long term, and we told patients living with cancer we would not provide coverage for that, we probably would have an uproar. And many people and clinicians are really lobbying to increase coverage and access for this medication.
So just to be clear, is there actual evidence that shows that Wegovy has benefits that would warrant it being covered out of the public purse?
There is evidence if you believe that people who are living with obesity deserve improved quality of life and health benefits, because there's evidence that it reduces cardiovascular disease and complications, evidence that it reduces weight, which improves functioning and quality of life in patients. I think the challenge is that people can continue to argue that does it help with other complications with obesity? And there are many trials underway looking at sleep apnea, looking at a component of fatty liver, which is called MASH, and other outcomes as well. And we will continue to have that research and probably have that evidence in the not too distant future. But I think the most important thing is, as we continue to not have access, we have more people living with obesity, developing complications, and living with impaired quality of life.
Why did you say that? In many ways, that this rests on the idea of whether people believe that those who are living with obesity deserve to have better treatment options.
I think there's one notion here, and again, there's a lot of work we've been doing nationally to consider this. There's a lot of stigma about obesity, and I think many people have talked about the impact, including especially people living with obesity, of living with obesity and the stigma that it presents. And that's from healthcare providers, policymakers, and the general public. And so many people still believe that this is a eat less, exercise more phenomenon. This is about willpower. It's not a medical condition. And so the validity of obesity as a chronic medical condition continues to be questioned despite evidence, despite the neurobiology of obesity and how we understand obesity in 2024, despite these new treatments that really show benefits in terms of outcomes and weight loss.
Much of this is around, it could be around the issue of stigma, but there's a lot of this that is also about cost. This drug will cost $4,700 a year, essentially forever. As long as you take this drug, this is what it's going to cost. What are the concerns around, if 1 in 4 Canadians are living with obesity right now, is it not valid to raise questions? I know we don't generally talk about the cost of healthcare in this country, but is it not valid to raise questions around the cost of this drug?
I think anytime we have a treatment, we should definitely look at cost benefit. And so I'm not arguing that against the analysis of cost, but I also want to talk about two things. So let's talk about the benefits. So there was a request for more information about this medication and its benefit. And I would say we are having new evidence, and we have current evidence, as I mentioned, about cardiovascular benefits. So that's the first point. The second point is, for sure, these are costly medications, and we need to think prudently about, which medications are approved and for whom. I think here, if we're saying that 1 in 4 Canadians are living with obesity, there is a cost of inaction in terms of not providing care. Right? More people showing up to emergency departments with complications for obesity, or requiring surgeries unrelated to obesity care, or increased medication costs for all the other comorbidities like diabetes, high cholesterol, sleep apnea, so going for sleep studies, and the impact of costs on sleep apnea treatments as well, and so on. And so I could go on and on about the complications, and that's not even touching on the inability to go to work, employment, and some of the costs economically for our society.
But those aren't factors that the Public Health Agency, that the organization, the Canada's Drug Agency that would be assessing this would be factoring in. They're looking at the baseline costs of this drug. And if the drug, if 1 in 4 Canadians might be on a drug that costs at least $4,700 a year forever, when you run the math, that's a lot of money. And I'm not saying that the other counts don't matter as well, but presumably that's at the heart of this, right?
It is, but then I would also raise that we have semaglutide or Ozempic covered for diabetes, right? Which is patients are on these medications for many many years as well, and so then the question I have is, why is there a differential for diabetes for some of the medications and obesity? Like what would be behind that differential there? And so that is the question that's before us is, how do we conceptualize obesity? Is it equivalent to other chronic medical conditions? And if it's appreciating that there are many Canadians living with obesity and that means high costs, I think we should also appreciate the impact and equivalency with other chronic medical conditions.
We did ask Canada's Drug Agency for an interview. They declined. In a statement, they said that the new trial results have been published since its review in 2022, and that there can be a resubmission of this drug for review. Does that give you some encouragement that perhaps in future this drug could be covered by public accounts?
I think I'm hopeful. I think we obviously want to support Obesity Canada clinicians, patients want to support and advocate for resubmission. I think the challenge here is this is time. There are many patients in my clinics who have sought out after approval of Wegovy and the release of the medication when they could get that treatment as well as other treatments before that or that are coming down the pipeline. And it is very hard to say you don't have any drug coverage or can't afford this medication to those patients. And so I appreciate that and the opportunity. We will definitely engage in how we can support resubmission and advocacy for this. And we need to think about how we can do this in a timely way.
Dr. Stockalingam, we'll leave it there. Good to have you on the program. Thank you very much.
Thank you.
Dr. Sanjeev Stockalingam is the Scientific Director for Obesity Canada, Professor of Psychiatry at the University of Toronto, and the Chief Medical Officer at the Centre for Addiction and Mental Health. Dr. Joel Lection is a retired physician and Professor Emeritus at the School of Health Policy and Management at York University. He's been listening in. Dr. Lection, good morning to you.
Good morning.
Do you believe that Wegovy should be publicly funded as a treatment for obesity, given what you've just heard?
I think that we need to be careful about publicly funding it based on the current level of evidence. There is some evidence that it helps people with pre-existing cardiovascular disease, but most people with obesity won't have pre-existing cardiovascular disease. So does it prevent it? There's no evidence yet about that. And the evidence about people with cardiovascular disease is that over a 3-year period, 1 in 40 people benefit from it. The other 39 don't get any benefit. And about 16% of people who start taking the drug in this particular trial had to stop because of adverse effects versus 8% who were using placebo. So the bottom line is that a lot of people who try the drug stop it because of adverse events, and over a 3-year period, it benefits 1 in 40 people. So if we want to spend money on that, so that would be just under $15,000 for 3 years to benefit 1 in 40 people. We can do it, but it's pretty expensive. I would like to see better evidence before there's widespread coverage of the drug.
How much is cost a concern here for you? Again, as a nation, unlike perhaps other nations with a different healthcare system, we don't talk a lot about the cost of the care that we receive. This is, as I've said before, $4,700 on average a year for each patient, and you take the drug indefinitely. How much is cost a concern for you?
Cost is always a concern around healthcare. And we have to look at cost in terms of what else could we be doing with the money. So what else could we do around obesity with $4,700 a year for the people who need it? Could we, for instance, do something about the cost of high quality food versus the ultra-processed food that we see? Could we be doing something around public education, in terms of what you should or shouldn't eat. Should we be doing public education or should we be trying to improve what are called food deserts? These are areas of cities, usually low-income cities, where there's no grocery store that even sells good quality food. So we need to make decisions about how we spend our money. And unless there's better evidence that people are going to benefit from Wegovy, I would prefer to see it being used on a restricted basis. So if it's going to help people with cardiovascular disease, then maybe we should fund it for those people. But if it doesn't help them, we should also be prepared to withdraw funding.
And yet, as Dr. Sokolingham has said, if the drug can help people lose weight, that could help with their overall health, perhaps relieve some of the burden on the healthcare system more broadly, that there are other costs that perhaps we aren't factoring in when it comes to lost productivity, the impact of people having to go for emergency care in the emergency rooms like you worked in. Is that not worth considering in terms of funding this drug?
Sure, all those things are worthwhile. And if we have the evidence to show those things, then that makes a stronger case for Wegovy. But the evidence just isn't there right now. We don't know that it's going to reduce visits to emergency departments. We don't know that it's going to, aside from reducing cardiovascular outcomes, we don't know that it's going to have any other health benefits. We need better evidence at this point. And preferably, we also should need that evidence publicly funded rather than coming from drug studies that are funded by drug companies. So Novo Nordisk has been suspended from the industry association in the UK because of the way that it was promoting Wegovy to doctors in that country.
Tell me more about that, what your concerns are when it comes to that. I mean, what does that mean that it's suspended from that agency in the UK?
Drug companies have industry associations in each country. Those associations set rules around how drugs can be promoted. And Novo Nordisk broke those rules significantly enough in the UK, not around Wegovy, but around a similar drug, that the association suspended its membership there for a 2-year period. Drug companies make their money by selling drugs in volume. And it doesn't take much to convince doctors to prescribe drugs. In the US, we have evidence that a $20 meal, so that's a little more than what you would pay for a lunch at McDonald's, is enough to convince doctors to prescribe a drug.
How much do you think that has influenced, practically, how much do you think that has influenced the conversation around this drug? I want to talk about advertising in a moment, but you're talking about the role of physicians themselves. How much has that influenced this conversation around drugs?
I think that I can't speak to Wegovy in particular, but I can speak to drugs in general, that there is strong evidence that the promotion of drugs, either directly to doctors or indirectly to patients, and we saw that last summer around Ozempic, where there were ads for Ozempic on streetcars in Toronto, that that kind of advertising influences the way that patients ask for drugs and the way that doctors prescribe. And that's not always a positive influence.
Those ads are not just on streetcars in Toronto. I mean, if you watch television, if you are listening to private radio, if you are on social media, you will see those ads relentlessly. How has that shaped? And I ask you, as somebody who again worked in an emergency room treating people with obesity, how has that shaped the conversation around weight and weight loss, do you think, in this country?
It certainly made people more aware of weight and weight loss. But that's not to say that that's always a good thing. There are a lot of people who are what we would term obese, who have no problem with their body image, who are happy with the way that they look, And those people, when we focus on obesity, we can help some people, but we can also increase fat shaming, as it's called, and make people who are not concerned about their weight, they can become the object of ridicule. So I think we need to be careful about how obesity is how weight loss is being promoted. That's not to say that it's not beneficial in a lot of cases, but in other cases, it's not something that people want.
Let me just ask you, before I let you go, a couple of quick things. One is, do you think, we've been talking about public coverage of this, do you think private insurers will cover the cost of this drug?
Private insurers tend to cover most or nearly all drugs that are approved in Canada. However, they may set limits on how long they'll cover it. And we know that drugs like Wegovy, if you stop taking them after 2 years, which is how long they're covered in the UK, that weight comes back on. So you get private coverage for 2 years, you lose some weight, and then your insurance stops covering it.
The other part is that if this drug is not, and nobody's saying that it's a silver bullet, but it's been described as another tool in the toolkit, what have you, that if it's not living up perhaps to that promise, or the evidence isn't there just yet, what should be done for those who are living with obesity? Again, this is 1 in 4 Canadians, as we were saying earlier, and there's never been more information about how to live a healthy lifestyle. So what happens now?
That's a question that I lived with when I was in the emergency department. I worked in a hospital where they did bariatric surgery, in other words, surgery for obesity, and we saw some very disabled people coming into the emergency department who were having complications from the surgery, and there is no easy answer to how to deal with obesity, but we can't just deal with it on an individual level, which is what Wegovy does. We also have to deal with it on a societal level, and we haven't been doing a very good job of that.
Dr. Lection, we'll leave that there. Thank you very much for speaking with us.
Thank you.
Dr. Joel Lection is a retired physician, professor emeritus at the School of Health Policy and Management at York University.